Hello, welcome back to Refractions. I am Stephen Mallon. I am your host, and I am so excited that we have Naomi Huth joining us. So, Naomi, hi, thank you.
Hi, thank you so much for having me on here. It's really a pleasure.
Absolutely. So, if we can just get a little bit of background on you. So, what is your connection to the arts?
Sure. So currently, I'm the director of the art collection for New York City Health and Hospital in the Arts and Medicine Department. I've been here for a little over a year. And in my previous roles and my connection with the art world, I worked for about 10 years as a curator for a private collection. And before that, I kind of worked in different museums and a little bit with galleries, doing a mixture of curatorial work and working on adult public programs. I will also say that I grew up with art. My father's an artist, so I've kind of always been surrounded by art, even though growing up it was a very clear, I want nothing to do with this. I think the art world has a tendency to just pull people into it.
You couldn't escape. Yeah, so when we met, you were at the private collection. Can you talk just a little bit about like what your roles and responsibilities were there?
Sure. So as I said, I was the curator for that collection. And my role there involved everything from going to different art fairs, traveling internationally, domestically for different fairs, auctions, studio visits, working with different dealers, with different artists on work that I thought could be a good addition to the collection to kind of enhance what we had and really add pieces that made sense. I also oversaw all of the installations that we did. I helped organize dinner parties that we'd have sometimes with artists to kind of introduce them to more people in the art world, and also kind of do a little celebratory event when they might win an award or something along those lines. I oversaw everything with our database, our monumental sculptures outside, doing tours of the collection, kind of a little bit of everything.
Wow. And now at the hospital, you have, tell me a little bit about that. How many like locations are you responsible for and how many pieces of art?
Sure. So I think a lot of people, including myself before I had this role, aren't really aware that New York City Health and Hospital, which is New York City's public hospital system, has a pretty amazing art collection. We have over 7,000 pieces throughout 90 plus sites. So there's some hospitals that people are more familiar with, like Bellevue or King's or Harlem. And then there's other ones that people might not be as familiar with that are in Morrisania or Sydenham or out on Coney Island. So the collection itself kind of started in the 1930s with WPA murals. And then around the 1970s, there was a real push to have there be a cohesive collection. There were a group of people in the art world, in city government, and in the hospital system who all kind of got together, added about 3,000 pieces to the collection. And that's kind of where this whole collection started. However, the Arts and Medicine Department, which is the department that I'm in, wasn't really formed until, let's say, the end of 2018, 2019, and it's taken a little bit of time to kind of define what we do, how we're going to work within the hospital system, and how we can help make the work that we have as part of our collection accessible and really use it as a healing tool.
Okay, so your department itself, even though the collection is old, like your department is relatively new.
Correct, correct. So there were people who were in charge of the collection over the years, but as you can imagine, the hospital system is made up of doctors, administrators, nurses who don't have a real focus on art. So there were different people kind of looking after it, but the real decision at the, previously was that different people in the facilities would have to take care of the art that was on their walls, which it kind of means that some of the work and some of the care kind of falls by the wayside. So there was this decision that, we have a great collection, and our mission is to make it as accessible to New York City as possible and to use it in the spaces. And that means that we need to have an actual department whose focus is just on the artwork.
So you've got this massive location, you have 90 locations.
Mm-hmm.
And when we're saying locations, we're not even just talking, like you're talking about 90 different facilities.
Correct. So It's a range. So we have hospitals in all 5 boroughs. A number of those are full, let's say, like large hospitals. We have a number of long-term care facilities, and then we also have over 60 different kind of clinic sites, which could be anywhere from a very small space to a 4 or 5 floor building up to, I think if you or I were just kind of walking upon them, we would look at the building and think it's a whole hospital. But I think we have kind of different things that we use to differentiate them. But yes, it's over 90 different buildings or hospitals.
Yeah. So it's a ton of real estate. It's just, it's a lot of wall space. It's a lot of responsibility. It's a lot of opportunity.
Yeah.
So what's the process? Like, what is like an example of like, if a project comes to you or a project that's going on right now, like, what are the stages? Like, are locations coming to you first? Are the artists coming to you first? Like, how are things generated?
Sure. So that's a great question. And there are a number of different ways that things happen. One of the things that we've started doing was that we created an online art request form for staff in the facilities. That way, say there's someone who has completely blank walls and they are in a dental clinic, they can let me know exactly how that space is being used, what the space looks like, what the wall materials are, and kind of the general feel that they want. One of the things that we really pride ourselves on and we really try to do is not just put up work that looks nice, but it actually connects to the people who are using that space. So for example, people who are out in Coney Island and in behavioral health areas are going to have very different needs from a clinic or a space that does women's health in the Bronx. And so I really like to have a lot of conversations with the heads of the department, with as many people on the staff as I can. If there are patients available and that's appropriate, talking to them as well, and really finding out how is that space being used? What are some issues they've had in the past in terms of their general feeling and comfort in that space, and what are they looking to get out of it? Our staff they all work very, very hard. And we really want to create these spaces where people feel more comfortable and more secure in those spaces, not just the staff, but also the patients.
That's amazing. So, okay, so they're filling out the form. They're telling you, I've got these 3 offices. We're meeting patients there, and also in like the nurse's room where they're taking a break and everything. And it's kind of, it needs some life. So you start taking a look at the space and everything, and then do you go, I guess, to the collection first to see what you have already on hand?
Yes.
And are they potentially, if they request something that you don't have, what happens next?
So the way that we kind of fix that, of people requesting things we don't have, is I have conversations. I have long conversations of, like I said, what people really want the space to be. So for example, this women's clinic that I did recently at Morrisania, I had conversations with some of the staff of, what are the issues that you have when people come in? How are they currently feeling, and how do you want to change that? So, they had kind of shared with me that some of the people who are coming in, it might be their first time in a clinic. They're a little stressed, they're a little uncomfortable, and we really wanted to reflect that the people who were there are really looking out for them. So what I did is I showed them a selection of work that was all done by women, and women of different backgrounds, different ages. Some of it was more abstract, some of it was more figurative. And then I had the conversations with them and with anybody else of, what do you like, but also what don't you like and why? I think that so often people don't necessarily ask what you don't like. And I think that that is often just as helpful as finding out what people do like, because we have so much work. So then once I get that idea of what really appeals to each person and what the feel is, then I'll send them a proposal of a large amount of work that I think could be a good fit. And together we'll work as a team to kind of tailor it down to pieces that they think really reflect that space and reflect their clients and kind of reflect who they want to be. And then we'll all go on site, kind of see what actually fits in the space.
That's great. So it's a cooperative aspect. It's not that you're just like telling you, I'm giving you these 3 pieces, put them up on the wall. They've got a chance to be integrated in the decision, and then Yeah, so it makes it more personal.
Yeah,
Nice.
100%. We have a evidence design-based approach, which means that there is a lot of research showing that art can change your mood, and whatever space you're in, that really affects your well-being. It affects how you feel and how you go about your day. And so when there's art in a lot of these spaces, it really can help the patients and the staff form a better and more trusting connection. And it can make the staff feel like they're in a place that has been designed and made for them, that reflects their ideas. It's actually really fascinating, because I think in the art world, we focus so much on not just the aesthetics, but of like who these artists are and what their career is and how that's important in the art world, rather than like what they're making and how it makes people feel. And there's been a lot of research that shows that when you are around appropriate artwork, it can actually reduce your stress levels. It can make you feel more of a connection and a sense of trust with your caregivers. It can actually reduce perceived pain levels. It's really amazing. And I think that so much in the art world, we just kind of take being around art for granted.
It's so true. I love the idea of being in that like research group of them, like putting up the images of the paintings and everything. We're like sitting there, with their chips and everything, saying if this painting is making us feeling relaxed or cared for, or if it's torturing me or not.
Yeah.
So you must have a waiting list then. If you put out a form saying, hey, does anybody want art? Like, how far out are you booked now?
We do have a waiting list. I'd say it is currently about 70 plus departments, I should say, that are on the list. And then there's a number that I'm working on right now as well. We're also trying to kind of get artwork into the conversation at the very beginning of new builds and new projects. I think that there used to be in hospitals, many years ago, there used to be art throughout all of the spaces. And that was just kind of accepted, that you have artwork, it's beautiful, it helps with the space. And I think as there became more and more of a focus on technology, the idea of technology meant clean lines, very minimal things on the wall, so that we focus on technology. And it became that we then have to make the case that art is necessary. So we're trying to show that, art shouldn't be an afterthought. It should be part of the whole conversation from the beginning, because it's really a very essential tool, especially with healing.
That's so great. So they're building a new hospital. Are you hopefully, talking to them about like commissioning like an artist to build like the escalator to make it interesting, or like where?
So yes and no. I think it all depends on what budget we have. Our department is entirely grant funded. So in terms of artwork and adding artwork, we accept donations. We also are looking for additional donors to help with us so that we can continue to acquire work. But when it comes to a brand new build, that is something that we try to have be part of the beginning conversation. That way, money can be set aside that maybe perhaps would have gone to a design team to put up wallpaper or to paint walls one color. Perhaps we can, rather than just have it be, a plain wallpaper or just beige walls, we can use that and incorporate artwork into the space from the beginning. I will say we did open up a brand new hospital in Coney Island, and they did a ribbon cutting kind of the beginning of this year. And part of that conversation was also like, let's get artwork in before people come in, before we get patients into some of these inpatient units, because we want that to be part of the entire experience.
The work was already up on the wall and it wasn't the afterthought.
Yeah.
Nice. Yeah. So are you still like actively looking at new work, or is this mostly, yeah?
Yes, yes, we are actively looking for new work. I think one of the key aspects that I like to focus on is, does the collection actually represent who it's meant to serve? So we are meant to serve all of New Yorkers, which means that our collection should be, in theory, the most culturally diverse collection in the world. That being said, when, we have a lot of our collection that was kind of added in the 70s. As I said, this is a new department and we are grant funded. So I think as we move forward and we continue to get more support, there are more options for us to do more commissioned work, to add in more pieces that fill in a lot of the holes that there are in the collection. Our work is always moving forward. There's always something that's going to be more contemporary and kind of newer and a great fit with a different message. So yes, we are
going to be
always
going.
looking.
Yeah, good. Good to hear. And then, so where are you finding the work? Are you going to Instagram? Are you, is it websites, newsletter, the galleries, the art fairs, all of the above? Or
all of the above. I think one of the things that's so great about being in, not just in New York City, but being in New York State, is that it is so easy to really kind of get a view of I don't want to say all the art that's out there, but there is a lot of artwork from other areas that come into New York City that's shown at different fairs, different small events. I try to set up studio visits as often as I can. I also try to be very mindful that if an artist is living in New York City, they may have other avenues and other areas that have been open to them because of whatever their background is. They just might have more opportunities. And we're trying to look for artists that really represent a wide variety of backgrounds. So, just by the nature of New York City being one of the most expensive cities to live in, it means that there might be a number of artists who could be a really great fit for our collection who can't afford to live in New York City. So I do try to really look whenever I go anywhere, if it's in the US, if it's in another country, try to just get an idea of what the art is there, whether that's in a museum, that's in a gallery, that's in an art fair, it's, someone that I've seen on Instagram that I've had other people recommend to me, just really trying to be very open to everything.
Fantastic. And so in the collection, do you have a rough sense of how much photography you have?
Photography, I'm going to say, again, I think all of your questions, it's a yes and no answer. I have kind of a loose idea. We are currently trying to reconcile everything in our database and make sure that we have an accurate number of everything that's on the wall, what its condition is, where it's located, and photograph everything, because that wasn't really done in the past. So I have a general idea. I would say not as much as I would like. We have a small number of some very, very good photographs, like Ming Smith and Dawood Bey, James Vanderzee. We have a large collection of his work, Ansel Adams, Herb Ritz. I will say, I think that photography is something really, really wonderful to have for almost for a specific non-art audience, because it's something that people can easily connect to and say, oh, there's a photograph. I have photographs of my own, or my cousin does that, and kind of use that as an entry point to really understanding what the work is. And then once they kind of decide, do they like it? Do they not like it? They can, take their own time to learn a little bit more about it. So I'm going to say a few hundred pieces of photography, but out of 7,000, that's not that many.
It's not a lot. I've never thought about that, what you just said about how photography in a way is more of an approachable medium, because people can recognize a photograph and understand, within, the general scope of everything, of how a print is potentially made. They may not know how to do it, and they may not know the current technology that's involved in everything, but the general idea of like seeing and having a print and having it framed up on the wall is not as foreign to them about as, potentially painting or, any kind of like fabric-based arts, that's really interesting. I didn't think about that.
Exactly. I think that there are a lot of people who just say that they don't like art, when the reality is that they just don't necessarily understand art. And it's so much easier to say you don't like something than you don't understand it. And I think a lot of what we try to do is make all of the artwork as accessible as we can. So we're on the Bloomberg Connects app. I don't know if you're familiar with that. It's part of Bloomberg Philanthropies. It is an app that has, at this point, I want to say over 300 different cultural organizations on it. We are the first and only healthcare organization on it. And it acts almost like a mini website. So you can put up information about your current exhibitions, artists that you have, video, audio, any of those sorts of things. So we are working with them. We are starting to put up signage throughout all of the facilities. We have QR codes on all the labels so people can learn more about the work. We've done some little audio tours. We have video, kind of just giving people a little idea of what we're doing. But what it allows is that when you have a patient or a staff member who is on site, it's not just here's something on the wall or even here's a photograph, like it's nice, but my friend can do this, or I have framed photographs. They can actually take a look, see who the artist is, what the title is, and learn a little bit more about who that artist is and what the reason is behind that specific piece in that specific place.
That's so great. So can people go to this portal?
Yeah.
It's public access?
Yeah, it's just an app. They can download Bloomberg Connects app and search for health and hospital.
Very cool. I've been to his office once. There was a book release of somebody that was connected to the, I think it was the former commissioner of the DOT. And so we were invited for it. And yeah, I love what he's doing, but that's a whole other separate conversation. So you've got it. So there's a database there. So the public can actually now go search your collection in the archives and see the work. So that's most of it, right? I mean, it's in
yeah.
process,
So what we're trying to do, again, I really believe in as much transparency as we possibly can and getting as much information out there so it can be used for education, for research, for whatever other people want to use it for. So we've been working to get up as much of the art in our collection on the Bloomberg Connects app. There still is quite a lot of work that isn't up there. We do have, I'm going to say, hundreds and hundreds of pieces up there. People can search for different artists, see some of the works that we have, and learn more about them.
Nice. One thing I forgot to ask was that, so the work, once it, like the stuff that was installed at Coney Island, how long are you planning to keep it there?
It really depends on the space. Right now, because a lot of the facilities don't have as much artwork or some of the, I would say, maybe not appropriate artwork, we're really kind of focusing on getting work up in all of these spaces rather than doing rotating works. So I would say that a lot of the times, once the artwork is up in a space, it's going to stay there, let's say at least semi-permanently. We have also started an exhibition program. So we have one of our first exhibitions will be opening at Woodhall in December. It's a mixture of work from our collection that's in conversation with work that was created in the creative arts therapy program at Rikers with incarcerated persons, and kind of looking at the different ways that people express themselves and how, even though we might be in different points in our lives, or some people are considered well-known artists, everybody has a lot of the same ideas and the same ways that they think about the world, and art is a way to express that. So that's going to be opening at Woodhall on December 5th. And
what's Woodhall?
Sorry, Woodhall is a hospital that's in Brooklyn.
Okay.
Sometimes I forget about about these things. So that's going to be an exhibition that goes up there, and that will be rotating. And we're also looking at having other spaces throughout different hospitals where we can have up an exhibition, maybe something that highlights work from our collection, as well as other programs that take place in other city agencies or within our agency, and then rotate those through. One of the things that's really cool about that space, which I think a lot of people don't know, is we have a 700-foot-long Keith Haring mural that he did in the 80s. And so this exhibition will be right kind of underneath some of the hallways where the mural is up.
Wow. Very, very nice. When did you say it's opening?
It's opening December 5th, and it will be up for probably about a year.
Okay. So it's time. Awesome. So how can people help?
Well, there's a lot of ways. People can help by supporting what we do through grants or donations. We are also always interested in donations of artwork, as long as it is appropriate. It's, I want to mention, I think it's really interesting that when people think about hospital collections or work that's going to be in hospitals, I think a lot of people think the appropriate work to have are images from inside of hospitals. And I think it's really the opposite. When people are in, they don't want to see paintings or photographs of people performing surgery or nurses or other doctors, because they already are around that. And that is kind of what is stressing them out, is the idea of getting a procedure done, of going to the hospital for the first time, going for an emergency. So we really do appreciate as many donations as we can get. They also, we also try to be really mindful about where they can be used. We are happy if people want to kind of connect with us, volunteer their time. We are doing so many different things that, we're always happy to have those conversations.
Yeah, it sounds like a lot and a lot of possible opportunity. Potentially overwhelming, but a lot of wonderful opportunities. So
Yeah, I think one of the things that's exciting about being part of a small team that is in its early stages and is growing is that everybody does have to work together, and there are so many opportunities for growth, for new projects, and for collaboration.
you had mentioned also like the you're 100% grant supported.
Mm-hmm.
So NEA, there's some grants for like art in hospitals and like healthcare and everything. Like, where are some other like grants? And have you got experience on grant writing? Is this something you're like acquiring?
I do not. If anyone is interested in grants writing for the arts and wants to kind of teach me how or help us out with that, yeah, I would love that. I think that's a really incredible skill that I wish was taught in undergrad and grad school. We luckily have some private donors who have helped support our department and really believe in the power of art as a non-invasive therapeutic tool. So, we're always looking for more donors.
I hear that. So what are some of your like goals and dreams for the next couple of years?
I would really love to have artwork up get everything that we have in storage, get it all out, get everything up on the walls in all of our different facilities, and really have a plan for each one of these hospitals on how we can make art a really important part of what they're doing. I think that just because we are a public hospital doesn't mean that the people who work there or the people who go there should be treated any differently from any other private hospital or private organization. I think everybody should be, treated with respect and should be welcomed into a beautiful space. So I would love to get that up. I would love to grow our department as well. I think that, as much as I would love to say that we can all do everything, I think the more we grow, the more work there is. I think ultimately I would love it for more people to understand that art really, really can change your mood. It can really change how you're feeling, and just make sure that art is part of all of these conversations as we move forward.
Yeah, like how do you assess that? Like when you're looking at new work or looking at the work that's in the collection, like what's the what are some of the factors or determination? It's like it's an evoking emotional response from you, but like how and when do you decide that piece goes into this facility? I think like
Sure. So I think there used to be this pretty standard rule of art in hospitals. Everything was okay as long as it wasn't red, because red is blood and red is an angry color, and that's difficult. I think there's been a new way of thinking, which is, what is the imagery in here? What are the spaces that we are going to be putting artwork in? So for example, we have a number of offices or staff lounges throughout different hospitals that don't have any windows at all. And they might be in the very middle of a hospital facility. So for those, a lot of the staff there have expressed to me that the lack of windows is something that's difficult for them to deal with. So for them, I would look for images, photographs, paintings, drawings, prints that are more kind of nature scenes or images that have windows in them, people looking out, people kind of enjoying nature, images of the ocean. I did a space in an ambulatory care clinic that, again, it was entirely windowless. And the works that we put up were all kind of different shades of blues and sand color, and they were very abstract images of the ocean. And I think a lot of the responses that we've been getting for that space is that it really changes their mood. It's, you have an idea of which corner you're going to turn around. The art can be used as a kind of a wayfinding device rather than it just being all of these kind of empty hallways. And it also kind of, it makes people feel happier in that space because there is artwork that they know is there for them and reflects their needs. When I've talked to different behavioral health departments, they have completely different requirements. So, nothing that has two kind of crazy lines. They kind of avoid some nature images that have paths that go off into the woods, can be kind of a little scary, a little bit of a trigger, nothing with like jagged mountains. We try to avoid things that have eyes in them, avoid words and numbers. So there's always different considerations. That being said, we do have a lot of offices that are in our central office building. So just because something doesn't seem suitable for one of the facilities or in one of the departments doesn't mean that it might not be appropriate in one of our office spaces.
So so it's like there's no real specific rule then because it like depends on which facility. So it's like if you're seeing something, it's like I feel like this is going to work. I don't know when, I don't know where, but
exactly. So if it's medical images, those usually aren't going to work. I did have some pastel drawings of vintage pharmaceutical bottles, which were really beautiful, and those worked perfectly for a pharmacy. But I feel like that's just, kind of peripherally related to medicine. If it's, really heavy black image, like black and white prints, that kind of feel depressing because that's, part of what the artist was trying to get across, that might not be something that's a great fit. So I think that's kind of, those are kind of the loose things that I look out for, do I feel kind of a little bit, anxious when I'm looking at this? Do I feel sad when I'm looking at this? Do I feel like the artist is trying to get across, violence or something like that? Those are images that just aren't usually a good fit. I think I'd say the same thing if there's a lot of religious iconography. I also feel that's not usually a good fit because we serve so many different people from different religious backgrounds.
For sure. Have you played with augmented reality at all? We were talking about the maps and everything, and I just kind of saw like Google Glass or the app, and having some fun little like AI, directing you down.
Yeah, so we've been having those conversations of, are there QR codes that we can add to different pieces that have, bring people to, an AR site? Are there glasses? Can we do an Oculus? Can we do something else? Of course, all of those, require money. So we actually are having different conversations to see that, perhaps we can pilot something that involves art, that involves VR or AR, that, could really be a tool for our patients and our staff.
I might actually know somebody at Google. I just realized there was somebody, he turned down ASMP because it wasn't big enough, but yeah, I might have a lead for you.
Great. Yeah, as I said, I'm always happy to, talk to anybody. I think very much that, there's so many people who all have kind of the same goals. And rather than work against each other, it just makes more sense for us to all be in conversation, kind of share what we're doing. Sorry, give me 1 second. I just got locked out.
I see you and hear you.
Okay, great.
Okay.
Technology. Yeah, so I really feel like, we can all share our ideas, share our challenges, and learn from each other.
Talking about sharing, is there an organization for hospitals that have got curators like you?
Not specifically for hospitals, but there is the National Organization of Arts and Health, which our department actually presented at their annual conference earlier this year. And they do really focus a lot on, as I said, on arts and health and how it can be incorporated into not just hospitals, but universities, and kind of, how it can be used as a therapeutic tool.
Fantastic. So what would you look for in a curator? Like if you needed to hire like a junior curator, like, like what would be some of the things that you would be looking for that would be a good fit for you and the job?
Sure. I would be looking for someone who is open to hearing different ideas, really listening to what other people want in their space. I think it's really, for me, that's the most important thing because, as I said, once we do these spaces, we're not in there and there are other people who are in there every single day. So, really listening to what other people want and using that as a guideline to curating spaces. Having an open mind for artwork that, you might not necessarily love yourself, but could be a really great fit and someone else might really love it. And it might be the piece that opens them up to art. Somebody who is eager to learn and eager to work with, with other people in lots of different people and different settings. Because we have so many different sites, every single one and every single experience installing and curating, it's completely different.
Yeah. Again, it sounds like, it's great because you have so many opportunities. It also sounds overwhelming. And I'm just like, kudos to you for like, for tackling it.
I think I'm lucky that I have pretty good time management skills, and for better, for worse, my kind of entire world is art. So, if I'm doing something that has to do with art, I can really kind of like focus in, get that done. And in my, let's say, like free time, I'm also always around art. So everything that I'm doing kind of just helps me with this job.
Yeah, because even in, like you were saying, it's like even in your spare time, you're going to the opening. So it's just like it's fun, but you're still checking it out for all the aspects of it because it never, and you like that. It's
Exactly.
very nice. Well, I think this is everything I have. When like I think we talked about all of the arts. Is there anything else that you would care to share?
Sure. Yeah, I would love to share that besides the visual art in the arts and medicine department, we do also have some really wonderful programs that are made specifically for the staff, which I think, a lot of people don't think that besides arts therapy, that there are kind of any other art related programs in hospitals. And we have a program where we team up with the Brooklyn Museum and the Whitney Museum, and it's kind of a mixture of like arts education, an arts discussion and art looking, and then art making. And I think it's just kind of cool that our department as a whole kind of tries to think about all different aspects of art and how we can use it kind of just in a multitude of ways.
That's fantastic. Well, Naomi, thank you so much. This has been an absolute treat. I think I've learned a lot about this. I didn't know too much about the job. I kind of knew a tiny bit that it existed, but not to the scope. So thank you so much for sharing, everybody. And I hope everyone that is listening and listens to this afterwards goes to the portal and takes a look at the collection. And yeah. So Naomi, thank you so much.
Thank you so much. This has been such a pleasure. And if anyone has additional questions, they are free to reach out to me.
Awesome. All right. Thank you. I'm Stephen Mallon, host of Refractions. You can follow this on Instagram at B&H event page, as you know. And thank you again, B&H Events, for giving me the opportunity to do this. And I will see you all back here in a couple of weeks. All right. Thank you.
Bye.